There's techniques that have been developed to be able to safely operate on the heart, which require an incision in the breastbone and then putting the body on an artificial heart-lung machine. But to do coronary artery bypass surgery, the coronary arteries are on the outside of the heart. So because we don't have to stop the heart to go in and make incisions inside the heart to allow us inside the heart, techniques have been developed where we can leave the heart beating and then do the bypasses on the outside of the heart. The advantage of that is that the blood from the body doesn't have to go through a lot of plastic tubing. The trauma of taking the blood out of your body, taking it through a machine, giving it blood, we can avoid that by using these off-pump techniques. The way we do it, we have little suction devices that fit on the coronary arteries here. So the heart's beating, we can put suction devices, hold that up, and make just this piece of the heart still that we need to do our bypasses on. Then we can make an incision in the artery and we put a little shunt inside the artery so that we can see what we're doing. And then now we have a part of the heart that's still, the artery's open, but we're able to see what it is we need to do our bypass. And then once we get our bypass done and before we tie our sutures, we take the shunt out, tie our sutures, and then we can take this off and the heart is beating. So all that's done with the heart beating. And then there's techniques where we use a little suction cup on the top of the heart, and we can move the heart around so that the heart can continue to beat, but we can look around behind the heart to get at these arteries, and yet the heart is still pumping blood through the body. The advantage of this in general is that you're not having to take the blood out of the body, put it through a bunch of plastic tubing, the heart-lung machine. All of that causes an inflammatory response, and we avoid that. It's been shown that it decreases the inflammatory response in the body. We decrease the amount of blood loss and therefore the number of blood transfusions that people need. Some other advantages, potential decrease in the amount of renal problems after this surgery, renal complications. Some improvement, especially in women, survival is better with off-pump surgery. So I think in people who have only moderate to minimal damage to the heart, people who have had no damage to the heart muscle, they usually tolerate the surgery very well.